Today's presentation is on mental health awareness. All content and information in this video is for informational and educational purposes only. It does not represent the views of OUHCOM and does not establish any kind of educational mentor-client relationship. The content of this presentation may be emotionally challenging as it discusses sensitive topics surrounding mental health, including suicide. If at any point a break is needed, please be sure to take one, and also be sure to use the resources provided in this presentation as needed. Struggles with mental health are extremely common. It is nothing to be ashamed or embarrassed of. Mental health disorders are health problems just like any other health concern, and most importantly, they are treatable. 1 in 4 Americans suffer from a diagnosable mental health condition. 10% of Americans will suffer from a form of depression each year. 18% of people in a given year suffer from an anxiety disorder. Depression and anxiety are the most common, but there are many different kinds of mental health disorders. Depression is a common medical illness that affects how you feel. It can last anywhere from a few weeks to years. 1 in 6 people will experience depression in their lifetime. Some of the common symptoms of depression include feeling very sad or empty, sleeping a lot or not sleeping much at all, no longer having interest in activities you previously enjoyed, not wanting to spend time with friends or family, loss of energy or fatigue, and experiencing thoughts of death or suicide. For more in-depth information, please refer to our video on depression. Anxiety is a common response to stress, and an anxiety disorder is like having that stress response all the time, even to things that weren't normally stressful, or to things that shouldn't cause that stress response. 30% of adults will experience anxiety at some point in their lifetime. There are many different types of anxiety, such as a specific phobia. A phobia is an intense, uncontrollable, irrational fear of an activity, object, or situation. One example could be a phobia of flying. Generalized anxiety disorder is a condition where someone has anxiety about multiple aspects of their life. Panic disorder is a condition where someone gets panic attacks, which are episodes of intense fear and other symptoms, like a racing heart and shortness of breath. Social anxiety disorder, which is a condition where someone has an intense fear that they are being watched and judged by others, that can make it hard for them to form relationships and interact with other people. For more in-depth information, please refer to our video on anxiety. There are many different kinds of mental health care providers. A therapist is someone who offers therapy. They talk with you about your feelings and struggles and help you to work through them. A therapist can be a psychologist, social worker, or counselor. A psychiatrist, which is a doctor who has graduated from medical school and a psychiatry residency. He or she will work with you to find medication to help. Or a psychologist, who is someone who has a degree in psychology, which is the study of the mind and behavior, and the treatment of mental health disorders. They may offer therapy to patients, do research, or teach psychology at a college. If you are struggling with your mental health, please never be afraid to ask for help. The people in your life love you and they want you to be happy and healthy. Talk to your doctor. Your family doctor can help you find a mental health care provider. If you do have a plan to hurt yourself or others, please reach out for help. You can go to the emergency room, call the suicide hotline, or call 911. A list of resources that are available for you to use is included in this presentation. If someone you know is struggling with their mental health, reach out to them. Let them know that you care and are there to help. If you are concerned that they have a serious plan to harm themselves or they are about to do so, please call 911. It is not a betrayal of your loved one to make sure that they get the help they need to stop them from harming themselves. Encourage your loved one to talk to their doctor for help. On the next slides is a list of resources that anyone can use. This is a list of resources that anybody is free to use. It includes the Suicide and Crisis Hotline, which you can call or text and is available in both Spanish and English. Psychology Today is a website that will help you find a mental health provider in your area. BetterHelp is a resource for therapy that is done online. There is a list of CDC recommended resources, as well as the Substance Abuse and Mental Health Services Hotline that you can call or text. Thank you for watching this presentation. Again, if you or someone you love is struggling with your mental health, it is nothing to be ashamed of. There are many resources out there that are available for you to use. Please don't hesitate to use them. Thank you.